Hello, class. My name is Raphael Ward, and this presentation is Strategic Planning and Policy. This is for class CYB 535. And with that said, we're going to jump right into it. Okay, I chose a healthcare company because I have a lot of experience in healthcare, so that is the company that I chose. And here are some of the attainable goals. I'm sorry. These are goals that we think we can accomplish, improving patient care across the board. And the reason I put that in because I can see us hiring what we call a patient advocate, which is a director level position that will interact with each patient. And we're going to depend on survey scores to increase patient care and increase patient satisfaction. And that's also my second point, increase the patient satisfaction. That'll happen with a patient advocate coordinator. That is a person. And we're going to be opening new freestanding ERs each year. That is a thing that a lot of healthcare companies are doing. Instead of larger hospitals, they're opening smaller emergency rooms, standalone emergency rooms, and that is a good thing. That also will stop so much traffic inside of a hospital and reduce the spread of COVID and everything else. In reducing healthcare costs, I think everybody can agree with that. Healthcare cost is just way too expensive now, and we also got to remain compliant with all healthcare compliance laws, and there are many of them, and it is very comprehensive. With the number one being HIPAA. Okay, people in the roles, and here they are. The CIO, this is the person that will be responsible for defining the entire security posture. That is the lead person. Okay, and his or her security manager will be the person that will be overseeing the security operations center, as well as directly managing the security team. That is the direct manager. That person is going to report to the CIO. Your security engineer is a very important role. This person will build the security architecture and the engineering security solutions. Your security analyst is that is really the foot soldier. That is the person that's going to respond to all of the security incidents. They're going to investigate it. They're going to analyze it. They're going to be on call. So they're going to be really busy. But the CIO is the person who creates the entire vision for the whole thing. Okay, and here are some of these healthcare compliance and standards. There are many of these, but the ones I included are the biggest ones, which is HIPAA. Everybody knows that this is you protect. This is actually a federal law. It protects the private patient information from being shared without a patient knowledge or consent. The High Tech Act is this expands on the scope of HIPAA and provides standards for using IT to implement. I got to redo that line because I misspelled something. And then this next law, the EMTALA law, ensures the public can access medical treatment regardless if they have money to pay or not. I think a lot of us know that, but we just didn't know what it was called. We know if we get sick, we can go to the emergency room and don't have to pay a dime. That is knowledge right now. The next one is PSQIA. This law is enacted to encourage reporting and resolution of patient safety issues. And I put in there, being a healthcare organization, we must comply with each of these. There is no room for error when it comes to compliance. Applicable security policies, we're going to have a BYOB policy, no Androids. I've spoken for a long time. I'm totally against those on the network. No Android phones or tablets. There will also be a IoT, Internet of Things policy. Each of these devices will be behind the firewall, and if they don't communicate, we'll just have to open up ports for the source and destination TCP and UDP ports. And if that don't work, then we'll just go with another product. But they won't be on the network with our computers because they will be segregated and they will be behind a firewall. Another policy is going to be a multi-factor authentication policy, a complex password policy, and an electronic security policy must be completed before any permission-related requests are granted. Okay? Impact to organization if security fails, and I think we can all agree that would be huge. Any data breach in a hospital setting is going to cost a lot of money and result in a lot of lawsuits. It also harm the facility reputation, which could mean loss of business permanently. That means if a patient does not trust your facility, they are not going to go there, which will cause you to close down. Damage to your intellectual property. Violations of HIPAA, which is violating the federal law, like I mentioned earlier, means that criminal charges could be filed. So you could see your CIO, CFO, or anybody else in handcuffs if HIPAA is violated. And it could also lead to crippling financial impacts. Okay, some of the tactical plans that we have are we're going to leverage security benchmarks and compliance standards, study the NIST framework, Assess the cybersecurity maturity of the security posture. This will be done using the NIST framework, understanding the threat landscape. You have to gain a broad understanding of the threat landscape in order to be successful. That is important. And another huge one is planning the employee onboarding and education. Employees have to know how to recognize phishing emails because so many breaches happen from simple emails that employees just cannot recognize because they haven't had the training. In the division specific plan, the security standards for the division will be HIPAA compliance, and the security policies will be designed using the NIST framework, ensure regulatory compliance. We're going to perform risk assessment using the veteran risk manager with experience in the healthcare industry and set attainable goals in business and operational key performance indicators. With that, that's going to end my presentation. And the next slide is my reference. Y'all have a great day.